HIV and AIDS, the only virus that decided to come as a twin. Welcome to the Health Show. Today, we will talk about HIV and how it develops to AIDS. We'll also discuss some modern innovations on how to treat the virus. Now, in the early 1980s, a previously unknown virus surfaced, leaving scientists puzzled. Eventually, it was identified as the human immunodeficiency virus, or HIV. Now, this microscopic predator is responsible for causing the acquired immune deficiency syndrome, commonly known as AIDS. Now, the journey to unravel the origins of this virus and its exponential spread was a race against time, with researchers striving to grasp its devastating impact. Now, over 4 decades have passed since the initial discovery of HIV, and its repercussion has still been staggering. According to the World Health Organization, roughly 38 million people worldwide have been infected, resulting in approximately 33 million deaths. Now, such statistics underscore the urgency and the significance of this global public issue. Devastatingly, HIV and AIDS disproportionately affect vulnerable communities, amplifying the need for awareness and education to combat this insidious virus. Now, this is how the virus infects. The virus attacks mainly and destroys the body's immune system. Now, it leaves the individual susceptible to various opportunistic infections and diseases. All right. Now, it predominantly spreads through unprotected sexual intercourse, sharing needles, and usually from mother to child during childbirth or breastfeeding. Although significant advances have been made in treatment, there is currently no cure for HIV. Now, making prevention and early detection very crucial. Now, it is crucial to mention that HIV is not transmitted through casual hugging, through kissing, and even being close to someone. It can also be transmitted through using or sharing personal stuff like utensils, makeup kits, toilets. Unfortunately, HIV and AIDS have carried an unjustifiable stigma, often leading to discrimination and isolation of those that are infected. Now, it is imperative that we discourage and stop the misconceptions surrounding the virus in order to foster a supportive environment for those living with HIV. Now, education plays a pivotal role in dismantling the unfounded fears associated with transmission and ensuring that there is no one left to bear this burden alone. Let us join together in compassion and empathy in combating the ignorance with knowledge and understanding. Education is the cornerstone of prevention, empowering individuals to protect themselves and others. Now, condoms, regular testing, and access to harm reduction programs are vital in preventing the transmission of HIV. Now, how do you prevent being infected with HIV and AIDS? First of all, you have to practice safe sex. If you don't have a trusted partner yet, always ensure you use protection always. Also, do regular checkups. I will also encourage that abstinence is the best way to prevent HIV. You can abstain till you have a trusted partner and wife. Now, always avoid sharing sharp objects like needles, blades, and syringes. This could be a big risk factor in contracting the virus. Always ensure you know your partner HIV status before being committed or before having sex with them. Lastly, you can take PEP medication regularly if you think you can't practice safe sex or if you know that you are being at risk of contracting the virus. As of now, we only have medications that can suppress the replication of the virus at an early stage. Also, I also love to mention that blood transfusion is a good humanitarian act. Now, the fear that one could contract HIV when you present to donate blood is real. However, you should not be afraid. Most syringes and needles are mostly disinfected and disposed of after use. Also, you could always ask if they are new, sterilized needles and syringes, if this will help you reduce your anxiety anyway. Medical research relentlessly seeks a cure to finally rid the world of this pervasive threat. However, eradicating HIV and AIDS requires the collaborative efforts of governments, healthcare systems, and individuals like you who spread awareness and advocate for equality. Now, together, I believe we'll be able to overcome HIV/AIDS with the right knowledge and with the collaboration that will provide to those who have the virus. Remember, our collective actions hold the power to change lives. However, I also love to talk about some myths and misconceptions about this virus. One of the common myths that is being peddled around today is that the AIDS pandemic is over. This is not true. The virus is still very much rampant today, and we are always at risk. Another rumor or myth is that only one certain group of people is at risk. This is absolutely false. Everyone is at risk and could be infected. Therefore, everyone should ensure that they abstain from activities that could make them get infected. Another misconception is that you can tell if someone has HIV by their appearance. That is not true. No one can tell if anyone has the virus, especially at a very early stage. This is because everything seems pretty normal during this stage. You have no idea. And mostly, people say this a lot. There is a cure for HIV. No, there is no cure for HIV yet. Even though there are a lot of attempts and research that have been going on to help reduce the spread of the virus, but there's no cure. So until next time, stay compassionate, stay informed, and continue to show empathy to those persons who you think may have the virus. Thank you, and see you in our next video. Bye-bye.